So we have quite a few patients that come to us with issues with the sciatic nerve. Sciatic neuritis, sciatica, there's a lot of different things that we call it. The typically the way it presents is, they might have some pain around the hip, they might have some pain into the leg itself, they may feel it with sitting. So there's a lot of different presentations that kind of go along with it. But we want to make sure that we evaluate it correctly, and we also want to make sure, because of the nature of sciatica, there's a lot of different places that the nerve can be entrapped. So we want to make sure that we know exactly where it is, they have the right diagnosis so they can get the right treatment. So just to give you some quick anatomy here, so you see these 4 nerves here coming out of the tailbone. They essentially merge together and they form the sciatic nerve. So on dissection, that nerve is huge. It gets pretty big. So at the largest part of it, which is towards the back of the hip here, there's a lot of there's a big reason why you can have so much entrapment on, because it's so large. So obviously it continues to run and then it courses down the leg, and along the path it can have irritation at the hip itself, also irritation around the hamstring, and then there's some muscle groups above and below the calf that can irritate it as well. The biggest thing that we do worry about is we want to make sure that if it is coming from the spine, kind of like I showed you on the model there, we want to make sure that we have the proper diagnosis for that, because we want to make sure they're in the right place for treatment. Sometimes they may need some additional imaging to rule that out. But essentially what we're going to do, we're going to put together a few more videos for you. We're going to show you how we evaluate it. We'll also show you how we treat it, and then some common advice and exercise that we give to patients as well. So look for those videos. We'll start putting those together for you. Thanks, guys.